You know that deep, nagging pain in a muscle? The kind that just feels, well, completely out of reach? It's so frustrating. Well, today we're going to dive into a really fascinating piece of medical tech that solves this exact problem, and it does it with a brilliant bit of physics. We're talking about something called interferential therapy, or IFT for short.
I mean, it sounds like a simple question, right? But the answer is actually pretty complex. Think about it. When the pain is way down deep in your tissues, how do you get a treatment right to that spot without, causing a bunch of discomfort on the surface? This is a really fundamental challenge in physiotherapy.
Yeah, you've probably seen setups that look a lot like this. And look, traditional electrical stimulation can be fantastic, but trying to get it to go deep enough can be, well, pretty uncomfortable. And the reason why all comes down to a very simple biological fact. So here's the problem. Your skin is basically an electric gatekeeper. I mean, it's an amazing organ, right? But it has a really high electrical resistance. It's literally designed to protect you, which means it naturally fights against the flow of low-frequency electrical currents. And here's the kicker. Those are the exact currents that are most effective for therapy.
So this sets up a real trade-off, a classic dilemma. On one hand, you have low-frequency currents. They're great for therapy, but they hit that wall of high resistance at the skin, and that can feel prickly, even painful. On the other hand, you have medium-frequency currents. These guys just slide right through the skin, no problem, which makes them way more comfortable. But here's the catch. They're not the right frequency to actually do the therapeutic work. So what on earth do you do? Okay, and this is where the genius of interferential therapy really comes into play. Instead of trying to just brute force a therapeutic current through that gatekeeper's skin of yours,
You create the therapy inside the tissue. That's the secret sauce. IFT doesn't send the therapy in. It creates it right on site, deep inside the body, exactly where you need it. It is such a clever workaround, and it completely changes the game.
all right, so here's the more formal definition. Interferential therapy uses two separate, totally comfortable, medium-frequency currents. Now, on their own, neither of these currents is actually doing the therapy. Think of them more like carrier waves. The real magic happens where they cross paths. So let's actually look at how this works in practice. We apply two different circuits. Circuit 1 might be sending out a constant 4,000 hertz current. Then circuit 2 is just slightly different, let's say 40-50 hertz. Both of these pass super comfortably right through the skin. They're just the ingredients for our recipe. And this is the interference part of interferential therapy. It's so cool. Where these two waves meet and intersect, they literally interfere with each other, and that interference creates a brand new low-frequency current. And the frequency is just the difference between the two originals. So you take 40-50, subtract 4,000, and voila, you get a 50 hertz therapeutic current generated right there at the target tissue. What you end up with is this very specific cloverleaf-shaped zone of low-frequency current deep inside the body. The therapy is perfectly localized right where the two circuits cross, which means the therapist can target the pain right at its source. But believe it or not, the cleverness doesn't even stop there.
Now, we're going to talk about tuning the therapy and customizing the current, because what makes IFT so incredibly powerful is that this new current isn't just a one-size-fits-all thing. Nope, it can be precisely tuned to get very, very different therapeutic effects.
Just take a look at this table. It's amazing. By simply tweaking the difference between those two medium frequency currents, a therapist can create what's called a beat frequency that does exactly what they want it to do. For example, a low frequency, somewhere between 10 and 50 hertz, that can stimulate muscle contractions. But if you dial it up to, say, 90 to 100 hertz, you get an analgesic effect. In other words, pain relief. Now, here's something you have to remember. The human body is incredibly smart. If you just give it the same stimulus over and over again, it starts to adapt, it gets used to it, and the effect starts to wear off. So to prevent this from happening, IFT uses a technique called sweep, which is where the beat frequency is rhythmically changed up during the treatment. And this sweep isn't just random either. It follows very specific patterns, like the ones you're seeing here. The most common ones are called rectangular, trapezoidal, and triangular sweeps. And each one delivers that therapy in a slightly different way. So the key takeaway here is that the pattern is chosen specifically for the condition being treated. A rectangular sweep, for instance, gives you a strong, more aggressive treatment, which is perfect for chronic problems. A triangular sweep, on the other hand, is way milder and is usually the go-to for acute, sensitive, and really painful conditions.
All right, let's move on. From theory to treatment.
who can benefit? We've talked a lot about the physics, which is super cool, but what does all this actually mean for patients? Who is actually using this therapy and what for?
Well, the applications are actually pretty broad. It's very widely used for chronic pain relief. Think things like osteoarthritis or nagging low back pain. And because it can stimulate muscle contractions, it's great for helping reduce swelling and edema. It's even used to re-educate muscles for conditions like stress incontinence by targeting the pelvic floor. So it's really versatile. But of course, and this is really important, like any medical treatment, it's not for everyone. There are some important contraindications. For example, it shouldn't be used on patients with cardiac pacemakers, during pregnancy, or in any areas with active cancer or a deep vein thrombosis. Safety, as always, has to be the #1 priority.
And you should know, this isn't some brand new, untested piece of tech. Not at all. IFT has actually been around since the 1950s, when it was developed by Dr. Hans Nemec over in Vienna, Austria. Its use for muscle stimulation got really popular back in the 70s, which is why you'll sometimes hear it called Russian current. And today, it's a total staple in physiotherapy clinics all over the world.
This quote really just nails the whole concept. The main advantage is that patient cannot be given higher doses in low-frequency therapy. The skin resistance offered to the 4,000 cycles per second is very much less. I mean, that really gets to the heart of it, doesn't it? But using that medium-frequency carrier current, IFT can deliver a really powerful therapeutic dose deep into the tissue, but with way less skin resistance. And that just means more comfort and ultimately better results for the patient. So to sum it all up, interferential therapy is just a brilliant application of physics. It's like a clever biophysical hack. It uses that fundamental principle of wave interference to sneak past the skin's defenses and literally build a customized low-frequency treatment right where it needs to be. It really makes you wonder, doesn't it? As our technology gets smarter and our understanding of the human body gets deeper and deeper, what other clever workarounds like this might be waiting for us? What other elegant solutions are out there, hiding at that fascinating intersection of physics and biology?